Hello everyone, my name is Viviana Martinez and my presentation was on increasing completion of a non-preferred task with alternating reinforcements. So at the beginning of my study, I focused on two specific reinforcers. They were highly preferred by the participant, and I continued to use these reinforcers even though I later had different results from what I expected. The participant is a 29-year-old male with no significant medical history. The reason I wanted to focus on this study specifically was the social validity is increasing a non-preferred task is usually seen in the field of ABA with younger kiddos who need to complete non-preferred tasks and are learning daily living skills. So I wanted to try the study on a participant while I can control the reinforcers, and so I would be able to generalize my findings when I work with kiddos, and ultimately would want to generalize the procedures. So speaking of procedure, I initially collected baseline data for a week, and there was no reinforcers given during this week, and as you can see there, the baseline data was at 0 across the board. And once I introduced the reinforcers on day 1, we did see an increase, specifically for reinforcer 2, which was the cookies. And if that's how I went for the first week of introducing reinforcers, then as I continue to collect data, we can see that there is a bit of some inconsistencies. There was some increase with the second reinforcer, which was chips, but we began to see dips. And as I spoke with my team members and we reflected on my results, I was told that it would have been better. It would have been a better idea to maybe introduce a token system, and that way they would be working towards a bigger reinforcer instead of getting the reinforcer on a fixed ratio system. And I agree. I feel like if I could go back, I would go ahead and do that and see. I would be interested to see how my data would differ. And you can see here the way I was collecting my data was just on whether or not the non-preferred task was completed on that occasion. I collected data twice I have here session, but that's just a day. So I collected it during the morning and then once in the afternoon, whether or not the task or the non-preferred task was occurring in the presence of either reinforcer A or reinforcer B, which you can see here I used reinforcer A chips, reinforcer B cookies, and my design is alternating treatment designs. And I have not mentioned yet the non-preferred task here is increasing washing dishes, and I have here the method that I used. The independent variable was the reinforcers, dependent variable, as I mentioned, was the non-preferred task. And like I mentioned earlier, I feel like if I was able to do this research again, I would go ahead and use a token economy, or I would increase my fixed ratio system to an FR5 per se and have them earn the reinforcer. The limitations I had with this study was, of course, the sample size was only 1, and I would go ahead and do this study on younger kiddos as well. Mostly the non-preferred tasks that I have some issues increasing with certain kiddos who are acquiring daily living skills is usually like dressing behaviors or performing chores around the house. So I thought this was, I wouldn't change my my non-preferred task if I were to do it again. I think I would still use washing dishes just because I feel like it is socially valid, and also it should be generalized. And Yep, that is my study and my findings. Thank you.